Hey, hi, Dr. Stevens. Thank you so much for your time and for doing this. First off, I thought I would ask you how to share how you're connected to Boston Harbor Elementary School.
Well, both my daughters have gone to Boston Harbor Elementary. So Hazel and Cece, who's now in fifth grade, this is our last year, which is
Gosh.
very exciting. Yeah.
Yeah. Okay. And tell us a little bit about your job. What do you do?
So I'm a pediatrician, so I get to see kids. I'm sure there may be, hopefully, some kids in your audience. So I'm their doctor, which would be cool.
Yes.
Um, and so I get to see kids from when they're born and babies all the way until they leave for high school and go into college. So it's a pretty cool job.
Very cool. And so I imagine we've been talking about the engineering design process and just problem solving and how you
Right.
don't always get it right the first time. Sometimes you have to iterate or change things and
Yeah.
kind of tackle a problem a new way. And
Mhm.
do you ever have challenges like that in your work?
Well, we absolutely do. And I was looking at your link before we started about how yours were I'm just going to click over to it maybe, but it was the imagine and plan and then create and then test and improve and then share.
Yes.
And we do that in medicine. We call it plan, do, study, act. So it's the exact same sort of cycle. So we call it the PDSA cycle where we plan it out, we do it, and then we see if it works, we look into it, and then we act and make changes, plan on it, and do it again. So it's sort of a very similar pathway to the engineering pathway. And we use
Okay.
it quite a bit. I mean, I use it with patients all the time. Like they come in with a symptom. And a kid the other day who was getting sick all the time. So he's getting sick over and over and over, and we can't figure out exactly what's going on. And is it that he have allergies and he just happens to be getting sick from friends, getting the runny nose and all that
Mhm,
stuff over and
mhm.
over, or is there something else going on? And so I build a plan in that's sort of step one, what are we going to do? And let's see if it works. And then I have a step two and a step three that hopefully we won't get to. But yeah, so I do that a lot from that standpoint. But I'll tell you, with the COVID pandemic, we have been doing tons of the PDSA cycle, that plan, do, study, act, tons and tons.
Lots of problem solving and lots of new challenges, I would imagine. So,
Absolutely. I mean, even just thinking back 2 years ago when it started, I mean, I used to see kids with my bare face sticking out. Like, I think there are probably kids at Boston Harbor who don't recognize me because I don't have my like mask on. But if I put a mask on, they'd say, "Oh, I recognize that guy." But I
right.
think that was really interesting that early on in the pandemic, when we were trying to sort out how to keep ourselves safe and then how to keep the next patient safe and how to keep people safe who are really, at risk of getting really sick. And so, we started wearing masks right at the beginning, and then we started studying it and decided that maybe these cloth masks were good, but they weren't great. And so we started using more of these like bigger, better N95 masks that have, better filtration.
Mhm.
Um, and then as we started learning about how it was more airborne, we kept wearing these. And then we're doing gowns and gloves and like face shields if someone is really sick. And then we were worried about kids coming in afterwards. Are they going to get sick? And what about our employees that are working and bringing these kids in? And so then we started putting like these giant filters in each exam room to help filter the air out so we can try and keep the air clean. And that has been a big stepwise approach from us. When we just started off with these, that was a huge step for me to wear a mask in every exam room. And now I think 2 years in, I would feel a little uncomfortable not having it on, that would be a transition away from that.
Right. Yeah, that's a great example that I think all of us can relate to.
Mhm.
Yeah, definitely. Okay. And how did you become interested in being a pediatrician?
Yeah, I, that's a, can be a long story, but I had a lot of health issues when I was a little kid. And so I was in hospitals and around doctors a lot. So I think that played a huge role for me, is that those were a lot of my role models.
Yeah,
So
so you
yeah,
saw the power of
yeah,
doctors and
yeah, those are the
pediatricians.
people I looked up to and I liked it. And then when I was in college, did this pre-med thing, but I was also an EMT. So I went out on emergencies and helped people. And I definitely found moments there that I really, really liked. So it was definitely sort of a process where I was like, yes, this is definitely something I want to take on.
Right. Okay. And so what's the best part of your job? What's the part that you like the most?
Oh, yeah, that's pretty easy. I mean, I think for me, it's being with the kids, right? I guess it would be the same for you.
Yeah,
All the
definitely.
paperwork and all the planning and organization and all the meetings are just so you can have that moment of being one-on-one. I think, over the years, having watched kids go from being babies to being fifth graders, is very cool. That's been a really amazing and sort of special role to get to watch these kids grow up. And now they're, I have patients who I saw who now bring their babies to me, which is very cool. So that's been
Oh,
really fun to watch them grow up and go through high school. And now they're bringing their babies back and they're these, smart, talented mamas, which is really fun.
yeah, that's amazing. Okay. So looking back to school, are there certain things that you did or certain things that you think really especially helped prepare you to be a pediatrician and to be a doctor?
Well, I always was passionate about school. I really liked school.
Mhm,
I think at times I got made fun of because I was so into math or I was so into science. I really, really liked it.
mhm.
But I ended up going to school for almost like over 20 years of school. And so I really liked it. I liked that process of learning. I liked the process of not knowing how something worked and really getting in and figuring it out. And then later knowing how it worked, I thought that was really powerful. So
Mhm.
that I would encourage kids to, just love learning, love the process, and find that thing that you're passionate about. It certainly doesn't have to be pediatrics and vaccines and immunizations, but find that thing you're passionate about and then just stick with it and go for it.
Okay, good advice. Any last things that covers my questions that I had?
Cool.
Anything else you wanted to share or?
No, I think that's it.
Okay, thank you so much for your time. I'll
You
stop the
bet.
recording here.
Okay.
Okay.